Hi, and welcome to the second series of Policy Unpacked, a podcast by Global Policy Network. In this series, we dive into the policies shaping our world, from healthcare to sustainability to education, and explore how these critical areas intersect to drive meaningful change. Whether you're a policymaker, practitioner, or just policy curious, we're glad you're here. Let's unpack policy together. My name is Amina Gazelle Sachi. I'm the CEO and founder of Global Policy Network, and today I'm joined by Stephen Riley, GPN Associate and Deputy Regional Chief Pharmacist for Pharmacy Integration, NHS England Northwest. I'm excited to share that in this series, we're going to mark a fresh approach to policy dialogue. Following our roundtable on the 25th of June, where Yusuf Ahmed and other national leaders explore the role of medicines in the 10-year plan, GPN has distilled those insights into a comprehensive policy report. Today, we're building on that momentum. Stephen will lead the next phase of this conversation, inviting expert speakers to delve deeper into the role of medicines within the plan. Together, we'll explore key themes ranging from hospital pharmacy to the transformative potential of technology in shaping future healthcare delivery. So, hi, Stephen. It's lovely to have you back. How are you?
Oh, great. Thank you. Really excited to be able to be part of this fantastic podcast series. And I'm really looking forward to hosting the discussions with our colleagues and their leads to really unpack this key policy area.
So, as we kick off this new series, what excites you most about unpacking the NHS 10-year plan, especially the pivotal role of medicines in terms of shaping the future?
Yes, certainly. Also, medicines is really a key function throughout the whole of the NHS. It pretty much is, apart from the resource around staffing health professionals, it's some of the largest spend we have on our healthcare as a nation. And so obviously medicines touch pretty much every aspect of healthcare. So it's a really fantastic opportunity to see what the plans are and the ambitions in the 10-year plan. So we've got the three key shifts from obviously analog to digital, from prevention to from healthcare treatment to prevention, and then also from the secondary care hospital shift into community and more of a primary care focus. And from a medicines perspective, and obviously from pharmacy professionals, medicines touch all of those key areas and play fundamental roles in delivery of those key ambitions. And there's a huge amount there to review, to understand from colleagues, get good perspectives of, and a huge amount to help deliver those ambitions for our NHS and to turn our health system into what we need going forward and build on the foundations from when it's been first developed and was first founded.
And from your perspective, what are the biggest challenges and opportunities facing pharmacy today?
I think overall, there's the biggest probably challenge for everyone. This is not just specific to the pharmacy sectors, but also the whole of healthcare and the NHS overall. Wider economy is obviously the tight resources available, the financial challenges, economic challenges. As we see, as you've outlined in the introduction to the policy series and the great work and the role you do at GPN, there's so many determinants of healthcare through different factors, economics, housing, environment. They all have a big impact on our how we live and how we live our lives. So the economic climate we live in is a massive barrier to pharmacy in terms of businesses operating. We've had those examples recently. We've had just come through the COVID pandemic, which has been a massive cost and challenge to the health system. And now, pharmacies from a community pharmacy perspective are challenging working conditions and environments. They've had recent hikes to try and improve staff wages. They have to fund. They've had flat funding for 5 years from the previous NHS deals. There's big squeezes on abilities for commissioners to commission more because the restrictions on their resources and a requirement for NHS bodies like ICBs to have a balanced budget at the end of the year. There's massive challenges on medicine spend and in terms of making most value and cost effectiveness. There's a big challenge through different systems. Big push on to increase volume to do more with less. Having said that, there are some fantastic opportunities on horizon, particularly around the ability to have a much more forward role in healthcare prevention and managing health population support, rather than just a traditional role of actually treating the illness. Is actually now how we can help prevent illnesses, help people live healthier lives, fantastic opportunities in the digital space as we move people to more digital arenas and improve access and interoperability between systems and help really integrate and join up healthcare. Some fantastic opportunities to better utilise our healthcare professionals. So particularly from a primary care perspective, we can better utilise community pharmacists, pharmacy technicians and their teams to really work at the top of their skill set and licenses to help deliver care across the primary care system, so we get the most appropriate care in the most appropriate setting to get the best value for our systems, ultimately the best access and care for our patients. And so people don't have to go and visit hospitals when they don't need to be there. They can focus on the more complex and challenging cases. We can work with our primary care systems to enable GP practice to work on more complex cases and prevent them going to hospital. So some fantastic opportunities in that arena as well. Also some really great opportunities to better utilise the skill sets of developing with our profession, particularly independent prescribing qualifications. All our new pharmacists from this academic training year onwards will become out as newly qualified prescribers. Pharmacy technicians can now work to PGBs. So some fantastic opportunities within our systems, and there's a good opportunity to try and turn some of these traditional barriers and challenges and try and change them onto the head into opportunities and work within our systems, and really great chance to fully integrate into healthcare pathways and deliver more for our patient populations.
There's clearly a lot of opportunities there. And now let's delve a little bit into the workforce development and professional roles. So how does the NHS 10-year plan redefine the role of pharmacy within the healthcare system?
It's as we look through, particularly I think the ambitions and the shifts, particularly the shift from treatment to prevention, and also for the shift from hospital into community. Those two areas, there's a lot of ambition around what could be delivered through the pharmacy professional and sectors, not just community pharmacy sectors, but also pharmacists working in a general practice setting and through wider primary care, our pharmacist colleagues working through hospital pharmacy settings, specialist centres, tertiary care centres. There's some fantastic opportunities there to fully utilise our workforce and develop it further. So as I mentioned previously, every new pharmacist that goes onto the register from 2026 onwards will come out as a qualified independent prescriber. We are the first profession to have the health profession for this to happen with, other than medical doctors. So it is a big, massive step for us as a health professional in that arena. There's also some fantastic opportunities to better develop our workforce, particularly around the pharmacy technician development training and apprenticeship program. So to develop a career pathway for colleagues in the pharmacy teams to work through to become pharmacy technicians who are, again, registered health professionals, skilled up, be able to deliver more clinical services independently through likes of patient group directions. There's some fantastic opportunity there. Great opportunity again to skill up our wider workforce for them to take on bigger roles and support the wider pharmacy team in that opportunity. There's opportunities as well to help professional development for our pharmacist colleagues as we move into advanced clinical practice. Again, which will be really essential for how we deliver some of these shift ambitions within the 10-year plan. And as you see, there's great ambition to not only to introduce independent prescribing services more through community pharmacy settings, but shift that sector into more of a clinically focused delivery. There's some fantastic opportunities there for our workforce. Within that, to deliver it, what we now need is we're working with our ICB colleagues, our workforce training education teams, to help support education training hubs within our ICB settings to incorporate pharmacy professionals better and more holistically support education and training developments across healthcare workforces, which has been maybe more traditionally focused on medical practitioners. There's a fantastic opportunity now to take that further.
And is there a single voice for pharmacy? And what is the interplay between representative bodies?
I think it's one of the elements of the diversity of our profession, and our, particularly in a community pharmacy perspective, we do have quite a variety of different representative organisations, different professional groups. So in some respects, it can be a hindrance to us because we don't have a unified pharmacy voice. So obviously we've got the recognised professional leadership body in the Royal Pharmaceutical Society. Unfortunately, we don't have every pharmacist is not a member of the professional body, and I'd love to see every pharmacist to be a member. professional bodies in a transitional period now moving to a Royal College. So again, there's a lot of work being done for them to how they're going to represent a strong professional voice while doing this transition. What will that look like going forward? We've then got a variety of trade representative bodies. So you've got the national representative body for Community Pharmacy, Community Pharmacy England. However, as I'm sure listeners will be aware, pharmacies in the community pharmacy sector, we've got a variety of business models and business types and large international multiples, like things like Boots, large company Roland's, people of that nature, and Co-op. They're larger multiple organisations. We then got smaller independent chains, small chains, and independent one-off pharmacies as well. So within them, we've got the Company Chemist Association represent the larger multiples. We've got the Association of Independent Multiples, which represents independents and represents small pharmacy chains. We've also got the National Pharmacy Association representing other colleagues. So that's just a variety of trade bodies. We then got different trade unions, such as the Guild of Healthcare Pharmacists, Pharmacist Defence Association. So we've got quite a variety of different representative bodies, and there are similarities. They do try to collaborate on key things, but we're not quite the same as some of our other professional colleagues. And it does, I think, that not having that unified approach at times can make it more difficult to try and get key policy things through from a wider profession perspective.
And coming to the role of the chief pharmacist within ICBs, do you feel that role should be mandated and should it be statutory?
I think it's an essential professional leadership role for our systems. So traditionally, when we had clinical commissioning groups before they merged to ICBs, we've had medicines optimization leads in our systems, and we still have, the role still exists currently. The ICB chief pharmacist has a key role around leading medicines optimization, leading the value program, cost efficiency programs is a real key part of their role. But the ICB chief pharmacist position is much more than just medicines optimization. Very core and important function. They've got an overall professional leadership responsibility for pharmacies, for medicines use, pharmacy professionals, all sectors. Also a big role of being a convener, bringing all colleagues together from different sectors and all the influential leads to help support developing pathways, making sure medicine supply is safe, effective. All the professional leadership is really essential. So I think, in my view, they should be a statutory function like we have with the medical director, some of the chief nursing officers. I think that those roles are essential roles for ICBs to have that clinical professional leadership voice. And given that, as we said before, medicines is something that touches every single pretty much part of a healthcare system and one of the largest resources and spends of an ICB, it's really essential to have that professional leadership voice, bringing all colleagues together and also leading those programs. I think it's really essential and there should be a statutory function.
And coming to digital transformation and innovation, what innovative practices are being introduced to enhance pharmacy services and patient care?
So we've had quite a substantial increase in digital development over the last few years in particular. We're really working hard now from an NHS England perspective and through our community pharmacy sector on developing interoperability between community pharmacy systems, GP systems. Big developments are things such as the GP update record and the ability for pharmacy services, once they've been delivered in community pharmacy, to actually update into the GP record of the patient. The access record functionality, so patients, their pharmacy teams can access and view a greater proportion of the patient record, giving better information, more up-to-date information, and helping them care for that patient. We've also been working on going to support transition and electronic prescribing ability from secondary care teams into community pharmacy through EPS prescriptions, which is something of a newer basis. More work around transfer of information, be able to view medicines usage in real time, review consultation data quicker. Some of the key factors was really great move forward. We've got particularly one of our ICBs in the Northwest is development of a ICB shared care record. And this not only incorporates GP practice information for patients, but also hospital data, social care information. So allowing our healthcare practitioners to access this information patient record really helps them care well for that patient, get the best possible information, help provide the best support for that patient. So there's some of the real key digital functionalities we've had. We've also had digital work ongoing to streamline functions and make it easier for pharmacy colleagues to deliver services so they don't have to spend as much time on the admin and automate process as much as possible. Also systems available now that enable referrals from GP practice into pharmacies and the pharmacies to refer on to other areas. all that are fundamental to support the delivery of the analog to digital shift in the 10-year plan.
And now let's talk about system-wide collaboration and public health. What role do medicines professionals play in the broader context of collaborative healthcare, particularly in preventative care and chronic disease management?
That's a really good key point there. I think so. For the 10-year plan shifts and ambitions to work, collaboration across systems and integration of services are going to absolutely key, particularly with the need to do more with less, or well, the best more of the same, but potentially more with less resource available to us. And we have a great opportunity around the development of neighbourhood care models. So we've got the primary care network models currently, with largely based on GP practices. The neighbourhood models enable much broader inclusion of wider healthcare professionals, so pharmacy professionals, dental, optometry, secondary care colleagues, and a fantastic opportunity to work in that multidisciplinary approach to holistically care for that patient, to make sure they get the right care at the right time in the right place. From a system collaboration approach, is what's really essential across our systems, is to have that ability and inclusion of pharmacy professionals, other healthcare professionals within the development of care pathways. And then so we can, all the services we've got commissioned from different perspectives. We've got like services commissioned from a national team, NHS England from the community pharmacy contract. We've got local services commissioned through ICB colleagues. It's how we then utilise those service abilities to develop a patient pathway that's built around a patient. And that's really a really crucial thing. You always need to remember there's a patient in the middle, and that's what we're all here for, is to serve that patient's population need. As services and things develop and models develop, then it really enhances the ability for our health professionals, medicine professionals and pharmacy teams to actually really take a good, much more forward approach and role in population health management and public health, particularly in that shift from treatment to prevention. There's a fantastic opportunity. We've already got services commissioned that have been running really well, such as the blood pressure case finding service through community pharmacy. There's more fantastic opportunities to work with our colleagues and utilise community pharmacy teams almost like health hubs built into their communities, and make them an integral part of those neighbourhood teams. And they could even become potentially a almost front door access approach to the NHS. But there's a fantastic opportunity through various health elements, and the fact that it's trusted health
Excuse me.
and trusted partner. There's a fantastic opportunity for them to support those local areas, local citizens, cohorts of patients. And we take a fantastic role in public health, particularly in managing and supporting our underserved communities, those that may be more disadvantaged in areas of deprivation, and really help and support them. Because those teams are based in those communities. They understand the cultures. Quite often they're made up from people in those communities. They help overcome language barriers, things of that nature. There's fantastic opportunities there as that system collaboration to really best utilise all the healthcare resources available to us.
And in what ways can pharmacy and medicines professionals contribute to public health initiatives like vaccination campaigns under the new plan?
So there's a fantastic opportunity to build on the foundation we currently have. So, example, at the moment, we've just in the Northwest, as part of a wider national pilot, we've just launched a pilot scheme through a key number of community pharmacies to deliver the RSV vaccine, a pertussis vaccine, to help improve uptake. We've worked on vaccinations through influenza vaccination programs and COVID vaccination programs for quite a number of years. There's a real fantastic opportunity within a neighbourhood model approach for pharmacy teams and also GP practice teams and wider healthcare professionals to work collaboratively to support maximal uptake and delivery of our vaccines. The more patients and at-risk citizens we get vaccinated, the better impact it's going to be overall in protecting our communities and reducing ill health, which could become complicated health conditions and lead to much more burden on resources on the NHS and obviously impact on patients and their families. So by utilising those opportunities, so the community pharmacies, for example, are based in their communities, they're part of those communities. They can help give trusted messages to the local community. So particularly where there's cultural differences and barriers, they can really help as trusted people in those communities help overcome some of those barriers, improve vaccination uptake. Vaccination is one of the greatest public health interventions we have, and that'd be a really positive way to build on that and develop for the future.
And implementation and collaboration are really, really key. What have we already achieved, and how might we improve that under the plan?
So we're quite fortunate. So from my perspective and from a Northwestern perspective, the role I do from pharmacy integration, we have really good working relationships across our ICB systems. I've got key pharmacy professionals as community pharmacy clinical leads in place in each of our ICBs, really do act as linchpins and key conveners and bringing the systems together, making sure pharmacy's got a voice at a senior level. We're part of development of implementation plans going forward. So one example is like the Pharmacy First service was launched in the last 18 months or so. We've really come together to help support a clear implementation approach. So we work to give clear information to GP practice colleagues or the healthcare professionals that are fully aware what the service is about, how we can enable and facilitate them to refer into community pharmacy, show what the benefit will be for them as practitioners, their patient cohorts, working with ICB commissioner colleagues to show how the service will benefit them as commissioners and systems, working with patients to make sure they're fully aware what the service entails, how they can access the service, and then working closely with our local pharmaceutical committees and our pharmacy colleagues to make sure they're fully aware of what the service requirements are, help support them with training events, clinical support, education in advance, and get them skilled and ready to go with the service when it's launched live, encouraging sign up and delivery, and then working with them to overcome challenges, barriers, and sharing good practice. All those things collectively really help us implement well. And it's got to the point now, so the last year, I think we delivered nearly 500,000 clinical consultations. Overall, pharmacy first consultations overall with the three arms of the service, and that's really helped support that, embed that service now. And you've got patients returning back to pharmacies because they understand how the service works, they've had good experience, they've been treated well. That's really been beneficial to our patient. But everyone's a consultation that would have had to be managed by another part of the system, but it's been managed effectively by pharmacy. So building on that approach now and that foundation is going to be absolutely essential. Those authentic relationships and working approaches, how we deliver the 10-year plan, and having those system approaches, being able to have honest conversations, work together to implementation plans, understand each other's needs, how it works the system. I think the key thing, keeping that patient in the centre and building around that patient care is always going to be crucial. That's really going to help us deliver the 10-year plan ambitions.
And how will the plan address supply chain challenges to ensure consistent medication availability?
So there's some key elements I think there, particularly around the analog to digital, and having better digital systems in place, better interoperability in place will help in terms of people's ability to understand what's available in parts of the system, what medications may be available, or where there may be challenges, help improve communication for GPs, patients, enable patients now for the NHS app to track prescriptions and things of that nature, see where they're up to, where they make it easy for patients to go and get prescriptions dispensed elsewhere as necessary. In terms of the clinical side of things, a shift to more clinically focused services and the better use of independent prescribing through community pharmacy will then empower and enable pharmacy teams to actually manage patient needs and make appropriate changes to prescriptions if there's a significant supply problem with the medication. If a pharmacist prescriber is able to be utilised fully, they can make the necessary amendments without having to go back to a GP, send the patient back, the patient's playing ping pong between the GP and the pharmacy. We can deal with that episode for the patient. It doesn't need to go back to a GP, so it doesn't have to waste their time with another consultation or further work. So again, that better use of clinical skills and ability in the plan will really help support that process. So I think there's some key things that will help. Some that helps with the supply issues we are facing, and another real thing that is the best thing for is actually proactive communication between pharmacy teams, between prescribers, having ability for secondary care teams to be able to interact with other pharmacy teams as well. Those local communication discussions are the best ways to overcome and help support our patients in the long run.
And what regulatory changes should pharmacists be aware of as the plan unfolds?
So some of the key elements, obviously, as more utilisation comes through from independent prescribing ability, there'll be services that will be developed in the life of the 10-year plan to incorporate prescribing services. They need to be fully aware of what those services entail, what the specifications are, what the limitations are. I think for pharmacy colleagues as health professionals, they need to always be very mindful of what their scope of practice is and their clinical competency, and not to be pushed or not to feel they have to go outside of that level of support, safe competency. I think as we do more services and things are done on a digital perspective and maybe delivered remotely, the regulator GPAC's put guidance out recently about making sure you do proper checks to make sure things are appropriate, clinically safe, checking the identification of patients properly to make sure the right thing goes to the right person that's needed, checking the authenticity of prescribers from other parts of the world or from a remote perspective, to make sure that the patients had a proper consultation and things of that nature. There's new work come through recently, obviously, around pharmacy technicians being able to do patient group directions. So while the legislation's changed to allow this, it's making sure people are fully aware of what the services commissioned are, what they allow, and able to deliver, who can deliver what parts of services, making sure your teams are safely supported, trained, so they're confident and competent to deliver their roles. And then there's some key elements from the automation side. So work's ongoing now to support the implementation of the hub and spoke dispensing ability from across legal entities. So again, just making sure you fully understand who's responsible for what part of the process, what your responsibility is. Do your due diligence when you're setting arrangements up and make sure things are safe. So there's some of the key aspects, and things will alter and change as we go through as enablers. It's really make sure you're up to date and linking in with key colleagues. We can come to our colleagues at NHS England or ICB colleagues for guidance and support about changes, or local pharmaceutical committees will be able to help as well.
And how does the plan incorporate feedback from pharmacists to ensure continuous improvement?
So the development of the plan initially was set, a large amount of consultation was done through, not just from the pharmacy side of things, but from all healthcare professionals. Obviously, organisations had opportunity to respond as an organisation. There was our ability for individuals to respond, members of the public obviously were a key part of this as well. There was a number of development events done at senior level through healthcare systems, to include ICBs, hospital leaders, things of that nature. Community pharmacy teams had the opportunity to make those responses themselves. Myself and other colleagues worked with our local pharmaceutical committees and worked with other groups of pharmacy professionals to understand their views, and also trying to understand the impacts for people delivering frontline healthcare. From an NHS England perspective, the Chief Pharmaceutical Officer led a number of working groups again to get key feedback from key organisations. So a lot of feedback and the opportunity was there as the plan was developed. Certainly what will happen now is we do go through our implementation plans, as we work now towards delivery of this 10-year plan, we will certainly work with our pharmacy colleagues to get regular views and feedback of how things are in terms of an implementation. What's it like delivering on the front line? Are there any unintended consequences? What's the reality? So we constantly work with colleagues and take feedback to improve policy and improve service development to try and support for optimal delivery and make it as easy as possible for people to deliver the fantastic patient care that our colleagues do.
And let's look into the future. Do you think the 10-year plan is ambitious enough in terms of pharmacy?
I think overall we were really pleased to see that, particularly from a community pharmacy perspective, there's some specific elements there where we were name checked and some specific ambitions for the sector. So I think in terms of obviously move to more of a clinical focused delivery and less of an emphasis on medicine supply is a welcome approach, and also the introduction of independent prescribing was positive. Having said that, we were working in that direction of travel anyway, so it's not significantly new ambition. And I know I'm linked into some colleagues. We're looking at some work with what could commissioning approaches be in the future and how could contracting be done in the future for pharmacy services. And we're looking from a broad spectrum of everything from what's the state of play and continue the as is, right through to let's get a blank sheet of paper and start again, and everything in between, and looking at all options. For me, I think I'd like to see things to go further and potentially a bit quicker. I think there's a potential, particularly with independent prescribing coming on board. I could envisage a future whereby you go to a GP practice to get a diagnosis of a health condition, but then the entire medicine side is managed by a community pharmacy team to decide what treatments will be within a formulary level, manage the prescriptions for the patient, manage that long-term condition. I can see the potential for that through a community pharmacy setting, just as a small part. I think there's a significant amount more we can do with pharmacogenomics. We can envisage a thing not too distant future where personalised medicine is a lot more the norm, and it's not just the case you may get given medicine A or B, even down to the point of what level of dose we give them. We can look and see if this will work for you at all based on your genetic profile and really personalise people's treatments in that way. I mean, we could essentially see in the future where medicines could even be printed. There is work on go at the moment looking into 3D printing of medicines and manufacture. So could it be a case where maybe you go to a pharmacy in the future and they actually just print your medicines off. It's sci-fi-ish, but the technology is going to right. So I think there's a lot more we could do with our pharmacy teams and colleagues to really push that limit, and take it further in terms of what we can do professionally and clinically, and things a lot, particularly around long-term condition management, federated models of pharmacy delivery like we have PCNs. There's a lot more we can do with those approaches, I think, to help support the ambitions of our 10-year plan and actually take our role much further.
And Steve, I'm so excited about this series which you'll be leading for us. So tell me, what perspectives or experiences from other pharmacy professionals are you most interested in as you explore this series?
Yeah, great. I'm really excited too. It's a fantastic opportunity to really gain key information from colleagues and leaders in other sectors. So I'm really interested to learn from system leaders from an ICB perspective, also chief pharmacist colleagues about their perspective of how medicine optimization functions work, their professional leadership of their systems, how they see the role of pharmacy and medicines in their wider system approach. I'm really keen to understand from secondary care hospital pharmacy leaders about the workforce approaches they're taking and opportunities within that sector, and then also how the specialised support and information they give around medicine, that can be widely used in the 10-year plan for our systems. Always have a passion for community pharmacy colleagues, but that's a role I'm linked into quite heavily, and to understand what the plans and their ambitions are for the sector from pharmacy leads, and how what they think they can do, what they'd like to do, what their plans are in terms of delivery, and how they can be a wider part of the health system. Also very keen to learn from colleagues around leaders in the digital space around the digital elements of this and what can be done, what plans are now and what they think the future from a digital perspective. So there's some fantastic opportunities here to learn from key areas of different sectors and see how all this comes together.
It sounds super exciting, and I can't wait to listen to the full series with you. So, Stephen, thank you so much for your time. Is there anything else you'd like to add before we go?
Yes, on this series, I think what I'd like to do is ask each guest a question for the next one. So, Amina, since I'm the guest in this episode, is there a question that you'd like to ask Youssef Ahmed, our next guest?
Yeah, I would. So how feasible does Youssef think a national formulary really is, and what obstacles would he foresee for its implementation?
That's fair. I'll put that to Youssef, and I'm sure we'll get a really good response from him.
Thank you so much. So this brings this episode to a close. So thank you so much, Stephen, for joining us today. I'm really looking forward to listening to the rest of the series. And as usual, make sure you give Global Policy Network a follow on all our platforms and keep up to date with all the things we're doing. So join Stephen next week for the next episode. And thank you and goodbye.